Hi, friends. I'm Dr. Molly. I'm a veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. Welcome to the Dr. Molly Says podcast. Hi, everybody. It is Monday. I am actually having a rough day because if you don't know this, I have chickens. My husband and I have had 2 silky chickens, and then we have 3 other regular breed chickens. And we actually sort of had to start over our chicken herd a few months ago because we had a predator problem and we lost all of our chickens. And so we redid our enclosure, we netted the top, got all new chickens, including 2 silkies. So excited about my silkies. They're the sweetest girls. And we have hawks in our neighborhood, and a hawk, I guess, has figured out that I have chickens back here, and I think it's been stalking them. And today it broke into our enclosure and killed 2 of my chickens, my favorite silky and one of my other chickens. So anyway, I just came home to record and discovered this. And so I'm going to try to not be weird while I record this episode, but I'm very pissed off about this stupid hawk. Nature is brutal. That's all I have to say. I know the hawk is just doing what it thinks it's supposed to do, but I am pissed. Okay, anyway, I do have a hot take. That's not the hot take. Hello, everybody. My hot take is because there's a bunch of discussion, hot conversation going around the internet right now from pet wellness grifters, which, Lord help us, who knew that was going to be a thing, about a new vaccine that's coming or on the market. And I just want everyone to hear me when I say that if you're consuming content on social media or on the internet, in a Facebook group, whatever, if that information is coming from someone who isn't a medical professional, not a veterinarian, not someone who works in veterinary medicine, but even if they are, if what they're saying does not align with what pretty much the entirety of the rest of the profession is saying, that should be a red flag. Okay. And I'm getting lots of DMs about these posts about this vaccine. And there's no such thing as a product that comes to market that was only tested for 2 weeks. Okay. So just everybody take a deep breath. Don't panic. Please stop listening to the cuckoo puffs. Cuckoo for Cocoa Puffs people. People who are just, you're doing exactly what they wanted you to do, which is panic and believe them and take what they say as fact and get into this tizzy about it. They're probably selling you an alternative or some type of guide. They are making money too. Everybody's making money. Okay. So you just think about the source. Anyway, that's my hot take. Think about who's telling you this information and don't panic. Okay. Today, we're going to talk about anesthesia. Why are we talking about anesthesia? Because I think anesthesia is one of the most misunderstood things when it comes to what pet owners think, what their perception is, what they actually understand. It's a very complicated topic, and it's a big pain point, I think, that causes some disparity between what veterinarians recommend that you do and what a lot of pet owners will do. A lot of that discussion is centered around dental treatments. So dental cleanings, dental exams, dental treatments, because those have to be under anesthesia for our dogs and cats. And I see a lot of hesitancy with anesthesia for that type of procedure, especially in older patients. So, and also lots of pet owners are nervous for their pets to go under anesthesia. Everybody hears horror stories about pets that have gone under anesthesia for routine procedures and passed away or had a huge medical emergency. And those stories are always very, very scary. I see them on social media, people talking about, my dog went in for a neuter and they died. And then all of a sudden, all these people are afraid to have their their pets go under anesthesia for any reason. So it's a huge topic that I want to try to get through to help you understand better what's actually happening when your pets go under anesthesia, what's happening at the vet clinic when they're there for that procedure under anesthesia or sedation. And I very much believe that educated pet owners are the best pet owners. So if you understand this better, I do think after listening to this, you're going to feel more comfortable about your pet going under anesthesia. That's my goal, because anesthesia is a really important tool that we use to take care of your pets. And most vets are doing it in a very judicious way. But not all anesthesia is created equally, which we're going to talk about. And I want to help you figure out what level of anesthetic care is being practiced at the vet clinic you go to, so that you can make some really great informed decisions about what's best for your pet. Okay, so let's just dig right in. One thing I think is important for you to understand or to differentiate is sedation versus anesthesia, because these two terms often get used for each other and they don't mean the same thing. So there are many things that we can do under sedation and not anesthesia. So sedation means that your pet is relaxed, they're sleepy, they might be asleep, but they're not fully unconscious. They still have reactions to things. They're still somewhat aware of their surroundings. Everything is just subdued. It's sedated. So we do sedation for many different procedures. There are a lot of situations where if we use a local block, so something that we inject into an area to numb feeling for a temporary time, then we give sedation. So we make your pet less aware. We give them pain meds and we block the area that we're working on. We can do things like wound repairs, laceration repairs, remove a torn toenail, procedures like that where we don't have to be very invasive. We don't have to open their abdomen, but we want them to be less aware and we want them to not feel pain. And so there are a lot of things we do that are under sedation. One way for you as a pet owner to know, is this sedation or is this anesthesia, is that if we put a pet under full anesthesia, usually we're going to have to intubate them. So usually we're going to have to put a tube in their throat, into their airway, so that they breathe through that and that we can breathe for them if we need to. So that's as much of a black and white differentiation as I can make for you, is that sedation does not put them under enough that they need to be intubated. And then there's also a question of which is safer, and there are a lot of factors for that. In some patients, anesthesia might actually be safer because we have more control over what medications, the level of medications they get. But in general, sedation is a lot less invasive. They don't have to be intubated. There are some inherent risks with doing that. And we have a lot of sedative options that we can actually reverse. So we can sedate a patient, do what we need to do, give a reversal agent so they wake up really fast and they don't have to go through a long recovery. So that's the big difference between sedation and anesthesia, if you were wondering. We're going to focus on anesthesia for this episode. Maybe we'll talk about different sedatives, sedation protocols as well in the future. So when we talk about anesthesia, I do want to get into the weeds a little bit of like the physiology of anesthesia, because one, it's very interesting. And two, again, I think it's really important for you to understand so that you feel more comfortable about your pet going under anesthesia, or even you as a person. I have a sister who's has her doctorate in nursing anesthesia. She's a CRNA, and that's what she does all day, is put people to sleep. And so she thinks it's cool what we do too. One day, maybe when she retires, she can come work for me or with me. So anesthesia is putting a patient in a plane of anesthesia. So we're actually depressing their central nervous system. Okay. That's what anesthesia is. We use medications, different forms of medications, which we'll get into, to actually depress their CNS, their central nervous system. So GABA is a neurotransmitter that has to do a lot with this. So a lot of our agents that we use for anesthesia enhances GABA. You don't really have to know that fine of detail, but basically we turn down brain activity. And anesthesia is very cool because it's this fine balance of we turn down brain activity low enough so that we can lose consciousness and awareness of what's going on. We can lose some pain awareness, and we can do all the crazy procedures that we do while they're under anesthesia and they're unaware and they're not feeling pain. We use different medications for anesthesia that do different things. Some of them are actually pain medications, so they block pain signal transmission. We use local anesthetics, like I was mentioning. Lidocaine is what a lot of you think of, bupivacaine. These are all local anesthetics that they actually block sodium channels, which stops nerve impulses in that area. So that's how that gets numbed. And that we all know if you've been to the dentist, you've had some type of block probably in your mouth that wears off over time. It's a weird feeling, but we use a lot of local blocks when we're using anesthesia. Anesthetic agents also relax muscles. So this causes the patient to relax, helps with induction and maintenance of their anesthesia. And so basically, we're just turning down the brain and awareness knob enough that we can perform these procedures without stressing or hurting the patient, but not so much that we stop their vital organs and functions from happening. And this is the beautiful balance and dance and art that is anesthesia, because in some patients who are sick or compromised, you have to be really careful with the way you do that. And because we are depressing the central nervous system, there are systemic side effects of that. And we're going to get into all of them. And those are the things that scare people that they hear about: heart issues, blood pressure issues, kidney issues, things like that. So we're going to talk through what actually depressing that central nervous system does in the body when we put patients under anesthesia. So one other thing specific that happens are cardiovascular effects. So when we decrease that central nervous system activity, we're going to, with a lot of medications to a certain degree, that can decrease heart contractility. So you can have the heart is not pumping as effectively or as hard as it normally would when the patient was awake and their brain was working completely normally. And their vessels can dilate, and so that can lead to low blood pressure. So low blood pressure is one thing we do see sometimes when we have patients under anesthesia. They can have a low heart rate. They can also have abnormal heart rhythms in response to that anesthesia. So these are things that we know can happen. And we're going to talk about how your veterinary team prepares for that, because they know this is a known side effect of anesthesia, even in normal, healthy patients. But what I hope makes you feel better as a pet owner is that we're anticipating those things. And so when they do happen, we have ways to manage them and correct them. This is a reason why it is really important that whenever a patient is going under anesthesia, that they have an IV catheter in. So we put an IV catheter in one of their legs, and that gives us access to their vein, their blood system at all times, so that if we do need to address one of those symptoms, we can. And we'll go through sort of a list of what should be happening with high-level anesthesia in a vet clinic. A lot of these anesthetic drugs are also going to cause some respiratory depression. Some of them can cause actual respiratory depression. So these dogs can have some apnea in cats, and they're not breathing like they normally would be because, again, remember, we've turned that knob down on the brain function. And some of them also decrease the brain's response to CO2, which is what triggers dogs to breathe, and mammals to breathe in the way that they do. So they can have slower breathing, shallow breathing. This is why it's very important that we intubate them and monitor those things. Another just known expected side effect of anesthesia is poor temperature regulation. So a lot of pets under anesthesia will get cold. So we do monitor their temperature, their body temperature. We watch that. If it's getting lower, we do things to warm them up. Most vet clinics that are practicing good anesthesia have some type of warming system to try to keep those patients warm, which is, again, while we monitor temperature the whole time, and often we'll do things like put baby socks on their feet to help them hold as much heat in their body as they can. This is because they are still, right? So their muscles aren't moving. So that's one reason they tend to get cold. And then another reason is because, like I said, their vessels can dilate. So that vasodilation can lead to lower core body temp. So just, again, something we expect, something that's not a surprise to us. We're ready for it. We do things to prevent it, and we react when it starts to happen. Okay, so let's walk through. So those are the big kind of ideas of what's happening in anesthesia when we put patients under anesthesia and what we anticipate. And those are the things that feel scary, right? So we're going to dive into them a little bit more. But let's talk about what happens from the time you drop off your pet for anesthesia to when they go home. So first thing that should happen, and it's probably happened before you bring your pet for some type of procedure under anesthesia, we've done a thorough physical exam and some blood work to make sure kidney function, liver function, other organ functions are good, make sure our blood cell counts are good. I think blood work is always a good idea. There's definitely been times where I've run preoperative blood work on a young, healthy patient and found things that makes us postpone a procedure and going under anesthesia. So preoperative blood work is always a good idea. As dogs and cats get older, as they have other issues that we know about, it becomes more and more important. And then obviously on a physical exam, we want to know, what does their heart normally sound like? How fast does it beat before we put them under anesthesia? What's their body temperature before? Does their chest sound okay? Is our mucous membranes nice and pink? Do we look pale? Things like that we always want to look at before they go under anesthesia. And in some clinics, that blood work is going to be done the day of the procedure, which is totally fine and honestly probably best. And then the exam, obviously, another physical exam of some sort is going to happen the day of a procedure to make sure nothing has changed if we've done one recently. So your veterinary team, when you bring your pet for a procedure under anesthesia, they're going to take them in, they're going to check all those things. They may start to give them pre-meds. So a lot of times I think pet owners don't understand all of this. A lot of times people are like, well, why do I have to bring my pet so early? If they're not going under anesthesia until X time, why do I have to bring them at 8 a.m.? So the reason for that, and some clinics are doing staged drop-offs, so they know what order they're going to do their procedures, and so they have you drop off however many hours before, and they can stage that, which I think is a really great idea. But in some clinics, they just have all their surgery or procedure patients get dropped off around the same time so that they can get everybody ready beforehand. And that works great in a lot of situations. If a pet is really stressed being in the clinic, that's another reason why doing staged drop-offs can be a really good idea. But when your pet is dropped off, the team is going to weigh them. They're going to examine them. They're going to make sure everything looks good. They're going to run blood work if they need to. And then often they're going to go ahead and give them some type of pre-medication. So pre-meds are often including some type of sedative just to relax them, make them less stressed out. This helps for when we induce anesthesia. It sometimes means we need to use less medications to actually induce them. We often pre-medicate them with a pain med if we're going to do a painful procedure. And so that gets pain meds on board before we actually do that. And then in a lot of clinics, they are going to be pre-medded with a medication called Cerenia. Meropitant is the generic name of that drug. And that will reduce the risk of them vomiting during or after the procedure. A lot of clinics have started using Cerenia just like as a given pre-med. There are a lot of reasons for that. I like Cerenia for all of my surgery patients. And there are studies that say Cerenia helps with a lot of things during and after surgery. So that's just a kind of newer component to a lot of pre-medication protocols. So those things will be given, relax the patient, get pain meds on board. We're going to get an IV catheter in them, so we have IV access. And in some patients, if there's a reason we need to start IV fluids before we put them under anesthesia, for example, patients that have kidney disease, sometimes that's a good idea. They might get fluids ahead of time. And then often for a few minutes before we actually induce anesthesia, they'll get some flow by oxygen just to make sure they really oxygenate their tissues really, really well. Get lots of good O2s before we do put them under anesthesia. So then when it's time to induce anesthesia, we will usually give some type of IV induction agent. So often those pre-meds are an injection in the muscle. And then when we induce and we actually cause the onset of full anesthesia, turn that brain knob down, that's usually an IV medication. There are a lot of different options. When we in vet med talk about an anesthesia protocol, this is a tailored plan of the type of drugs we use, the dose of drugs we use, a lot of factors that go into that. So your vet and their team are calculating, coming up with all of that when you drop your pet off. And in an ideal situation, that's somewhat tailored to your pet. Propofol is a very commonly used induction agent. It's what I like to use in most of my patients. There's another one called alfaxolone that we'll use, and I do use sometimes. So these are IV drugs. We give them pretty quickly. They actually induce anesthesia. So once that happens, they relax enough, they're unconscious enough that we can put a tube in their throat. So we do intubate these patients. We put this long tube that goes through their mouth into their airway, and then we inflate a cuff that it fills up kind of like a balloon in their airway, so that if they were to, well, lots of reasons, but if we're putting fluid in their mouth for like a dental, or if they were to reflux, get any fluid from their stomach to come up in their mouth, that blocks that from going down into their airway, because again, when they're anesthetized, they're not naturally protecting their airway. So the tube does that for them. And then that tube is used to deliver oxygen as well as maintenance inhaled anesthesia if needed, which we're going to talk about. So propofol, alfaxolone, and other induction agents, we give them IV. They induce anesthesia, we get a tube in the patient, and then usually we're going to start prepping for whatever procedure that we're doing. Those induction agents really only last a little bit. They last a few minutes to like 20 minutes or so at the most. And so what we do after we induce anesthesia is we'll often start a maintenance anesthesia. And for most clinics and most patients, that's going to be an inhaled form of anesthesia. So that's why we have that tube, because the anesthesia machine delivers this inhaled anesthetic agent into the lungs, and the tiny little blood supply that's in the lungs actually absorbs that through the lungs. It's very, very cool. So isoflurane is the most commonly used maintenance inhaled anesthetic. Sevoflurane is another that some clinics use, especially clinics that work on exotic animals, because they're working on teeny tiny animals or really, really big ones, and it's a little bit more sensitive. So they're similar. So one of those two inhaled anesthetic agents is usually what's being used to keep the brain, that brain knob turned down, to keep the brain sedated. So let's talk about monitoring for anesthesia. So we induce the patient, we get them intubated, we've protected their airway. We're going to start prepping them for whatever procedure's being done. There is a myriad of monitoring values that we want on the patient in an ideal anesthetic situation. And this is not the case in all vet clinics. This is part of what we'll talk about. So number one, we want to know, how is the heart beating and how fast? So we'll put leads on the patient, 3 leads that show us the rate and the rhythm of the heartbeat. And that's called an EKG. And then we'll also put this clip on that measures their pulse ox, or their pulse oxygen. So this is measuring oxygen in the blood that's running through that skin. And this is a good piece of monitoring that we always want to have, but it doesn't give us the whole picture as far as respiratory status. And so what's even more important is what's called a capnograph. And this is monitoring that measures CO2 levels. There's a couple different types of machines that measure that, but that tells us CO2 levels. This is really, really important. And an even more accurate monitoring value that tells us how is that patient actually breathing and getting oxygen. And then we also, like I said, want to measure their blood pressure. So there are a couple different ways to measure blood pressure depending on the type of patient. There are ways to do that. We can put arterial lines in patients to get a direct blood pressure reading from that. But that doesn't usually happen in general practice vet med, and it doesn't really need to. So we can get blood pressure readings with a cuff, like you think of in people. So we do that, and we measure that every 3 to 5 minutes throughout the procedure to keep an eye on blood pressure. And then temperature probes go in with the patients, and I think those are the big things. I want to make sure I'm not forgetting anything. Those are the big things we want to monitor when we have a patient under anesthesia. And I will tell you that not every vet practice is created equally when it comes to anesthetic monitoring, and not every vet clinic is monitoring and measuring all of those things. And some of that is because they don't have the equipment to do it. But I do think that it's important as a pet owner to be aware that that's something it's okay to ask. What are we monitoring? And monitoring all of those things is the safest way to keep an eye on our anesthetic patients. So when we first induce a patient, we're going to hook them up to all of that monitoring. Like I said, we're prepping them for anesthesia. And over those first few minutes, we're sort of transitioning to that patient was anesthetized from their induction medication that went through the vein to really just depending on that inhaled anesthesia to keep them under. And so once we get going, they're under anesthesia, they're being maintained by their inhaled anesthesia in a clinic that's doing things well. We're going to have a veterinary technician. Ideally, this is a licensed veterinary technician, but at least a veterinary assistant who's been specifically trained to monitor in anesthesia. So all that person is doing is monitoring the patient and all of the monitoring equipment that we have and recording those measurements and levels as we move forward with whatever procedure that we're doing. It's really important that there's a person whose sole job is to look at the patient, look at the monitor, and make sure that's jiving, and letting us, the surgery team, know if there's anything going on, numbers that look abnormal, trends that we want to do something about. So then throughout the procedure that we're performing, that's what's happening. Someone's monitoring anesthesia while the rest of us are working, and everybody has their job that they're focused on. Like I said, when we have patients under anesthesia, we anticipate one or more of those changes. So blood pressure can get low, heart rate can get low, heart rhythm can get abnormal, patients can get cold, and their breathing, they can have lower breathing, and there is a respiratory rate, I should say, or the quality of breathing that they're doing. So breathing really shallow, not really getting a good breath. So there's a lot we can do when our patients are under anesthesia to address those issues. In most procedures, our patients are going to have IV fluids going. I think I mentioned that earlier, but they have an IV catheter. We've hooked them up to IV fluids. Fluids are generally recommended for any patient under anesthesia for any kind of procedure, just to help maintain their blood pressure and blood volume. And we can adjust the rate of those IV fluids as needed. A lot of times this is in response to blood pressure. So when I have a patient who's under anesthesia and we start to have a little bit low blood pressure, we definitely look at the rate of inhaled anesthesia. Oftentimes we're going to go down on that rate to try to, turn up that brain knob a little bit and help with their blood pressure. And then if that doesn't help, we're going to maybe give them a little bolus of some IV fluids or increase their fluid rate. So again, there's a lot of little adjustments we can make to help with that. We're in that fine balance of what anesthesia is. And we do have medications that can help with blood pressure and different issues if needed. We have medications to help when we have low heart rate. And then if in the worst case scenario under anesthesia, if we have a patient who actually goes into cardiac arrest and for whatever reason they have an emergency like that, we do have emergency drugs in the surgery suite already calculated, ready to go to restart their heart if needed or do what we need to do to get them stable again. I want to say that does not happen very often. That's a rare occurrence, especially in general practice vet med. It does happen. It's very, very rare, but I hope this makes you feel better that if that were to ever happen, your vet team most likely is going to have a plan. They know what to do. They've got everything in the room with them to address that. I recently saw a post where someone's pet had died under anesthesia, which is so terribly sad, but this was a pet owner, and their post was about that their pet had or their dog had a reaction to their anesthesia. And I see that sometimes, and I think that's something, it may sound nuanced, but it's important to know that when we say a reaction to anesthesia, that insinuates like an allergic reaction. What actually happens most of the time if we have a bad outcome under anesthesia is that a patient has some underlying issue, like a heart issue or something else that we don't know about. And then when we inhibit or depress some of those things under anesthesia, that can worsen that condition and that can lead to catastrophic issues. In young, healthy patients, sometimes that's because they have some type of congenital defect in their cardiovascular system that, again, we didn't know about beforehand. So when I see those really terrible stories, they're horrible for the vet team involved, they're horrible for the pet owners. I do see people talk about reactions to anesthesia, but it's not an allergic reaction 99% of the time. It's just that when we put that patient under anesthesia, they had some type of issue, complication, and we weren't able to correct that. Knock on wood, I have not had that happen. Really in my 10 years of practice. Now that I'm saying that, something terrible is going to happen. But it happens to everybody who, if they do enough surgery and procedures in veterinary medicine. But just as pet owners, I want you to know it's very, very, very rare. And if you're in a clinic that's doing all of these things that I'm talking about to stay on top of monitoring, then it's even more rare. And I hope this makes you feel better. So then when we're done with a procedure, we're going to turn off that inhaled anesthesia. We continue to monitor all those things: blood pressure, heart rate, heart rhythm, capnograph, oxygen, while they start to recover. So we might be doing a laser treatment if we did a surgery, or giving medications for post-op. They're still breathing through that tube. We're still giving them direct oxygen. We're giving them support. And then once a patient becomes aware enough, their anesthesia is wearing off, where they can protect their own airway, meaning they're starting to become conscious and they're swallowing. That's how we sort of know that a patient's about to be ready to be extubated. They start to swallow on their own. We usually say we want at least 2 good swallows before we pull a tube out. And so once we know a patient can safely be extubated, we'll remove that tube. We're still going to monitor their temperature, their heart rate and rhythm, and their pulse ox usually after that, and their blood pressure if needed. So then those patients are in recovery, like we say, and they'll have someone at first with them one-on-one. And then as they become more awake and more stable, then we're going to do checks on them every so often. Every protocol for clinics is different, and it depends on what procedure was just done, how the patient did, all of that. So then in recovery, we just make sure that all of those parameters start to go back to normal. And then also, depending on what procedure we did, we're going to then send that patient home with more pain management, oral medications to go home. The cool thing about anesthesia and veterinary medicine is that with a lot of procedures, especially, more routine procedures like spays and neuters, those patients get to go home same day. We recover them from anesthesia and they're awake enough to walk out of the clinic and just be monitored at home with their owners. We do sometimes see some patients when they're waking up have some sort of delirium. They can vocalize, they can try to run away. Sometimes they do just sort of act a little crazy when they wake up. So if that happens, sometimes we give them a little bit of a sedative that doesn't knock them back out completely, but just helps smooth that out and calm them. And then again, temperature is so important, especially in small dogs. They can just lose body temperature so fast. So we often keep them in some type of warming unit to keep them warm as they wake up. Okay, I hope that is helpful, because that is sort of the trajectory of what happens when your pet is under anesthesia. Like I said, someone's one-on-one, or they should be monitoring every few minutes, recording all of that, looking at them the whole time. And when all of those things are happening, the risk of anesthesia really gets very, very low. Even in older patients with heart murmurs, different issues, the risk of anesthesia in veterinary medicine when those things are done is incredibly low. There are papers about this. Happy to share those with you about just how safe anesthesia can be. And I get frustrated because I'll hear or I'll see in a record or have a client tell me that a vet told them, "Oh, my dog's too old to go under anesthesia." And that really burns my grits, because if you have been here long enough, I'm very passionate about treating senior, old patients, dogs and cats. And I just think there's a lot of senior dogs and cats who miss out on getting proper veterinary medical care and being comfortable in their older age, because their owners have been convinced of this incorrect idea that they're too old to go under anesthesia, or anesthesia is too risky for them. And I would argue that in some cases, if a vet is telling a pet owner that their dog or their cat is just too old to go under anesthesia, for example, for a dental, it may be that their anesthetic protocols are antiquated and that maybe that dog is too old for their anesthesia because it's maybe not the safest way to do anesthesia. So if a vet ever tells you that and they don't have like a real reason for that, there's just age is the reason your pet shouldn't go under anesthesia, I would 100% get a second opinion. And then I also want to make sure you know that veterinary anesthesia is a boarded specialty. So there are boarded veterinary anesthesiologists, and that's all their job is to do anesthesia, like in people. And there is a veterinary technician specialty also in anesthesia. So there are licensed veterinary technicians who've been through extra training to be specialized in anesthesia. You will find most of these people in academic institutions, so university hospitals, or in big specialty hospitals where they're doing a lot of intense surgery all the time, or in large animal surgical situations. So if your vet also says your pet is too old to go under anesthesia, you can get a second opinion, but you can also talk to a facility or an institution that has boarded anesthesiologists and VTSs in anesthesia to see if they would like to take your pet's case on, because I guarantee they would. So let's talk about different factors that can increase anesthetic risk, maybe. Because I know this is something you all ask me about. So one, like I was just saying, seniors, older dogs, which if we're talking about small breed dogs, 10 or older or so, and then if we're talking about larger breed dogs, 7, 8 and older. Age is not a disease, okay? Hear me now. This is something a lot of us say. But with age does come more disease. So in those older patients, it's really important that we've done the pre-screening. We've made sure their kidney function, liver function, all that is good. And also be aware that as pets age, they become more frail. So it's harder for them to bounce back from things like anesthesia and procedures. And that's just a function of biological aging, right? We know that this is just what happens. And so this is where this sort of mythical idea of they're too old to go under anesthesia comes from. But when we know about that, we know that these dogs metabolize some drugs slower, we can adjust our plans for that and make it a very, very safe situation. There's hesitancy also to anesthetize really young animals, and this is just because they have immature organ systems. They're more likely to have underlying congenital issues that we don't know about yet. And we just have to be really careful with dosing and drug volumes in really young patients. A lot of shelters do pediatric surgeries regularly, and so they do a good job of this, but it's just something that we're always aware of when we're making an anesthetic plan for a patient. And then there are some breed-specific concerns. So in dogs, I talk a lot about brachycephalic dogs. So smush-faced dogs, bulldogs, pugs, Persian cats are brachycephalic cats, boxers, French bulldogs, all the Frenchies. So brachycephalic patients have a higher anesthetic risk, period, just because of the way that they're made. This is in studies, research, this is a real thing, that just being a brachycephalic patient increases their anesthetic risk. And so there are some very big things that we do and tweak a little bit when we're putting those patients under anesthesia. For me, one thing that I try to do is I pre-med them sometimes with different medications to try to reduce the risk of reflux and regurgitation. I try to get them intubated quickly, and so sometimes that changes the way we do their intubation medications. And pre-oxygenation is really important in these patients because they have a hard time just breathing in their real life, period. And then monitoring them even more carefully in recovery. Those are some of the big things that we do for these brachycephalic patients. If you didn't know this, sighthounds, so greyhounds are the big one people talk about. They can have slower metabolism of certain drugs that we use with anesthesia. So we may avoid those and use our alternatives or use different doses. So this is just something that your vet can and should be aware of. A lot of sighthound owners are very aware of this and make sure that we are too, but just something interesting to know. And then in our little tiny toy breeds, little bitty dogs, and in small cats, we just want to be very aware of their temperature. They're more likely to get hypothermic, and that can lead to big problems. So we take a lot of care to make sure those little tiny dogs and cats stay warm. Cats and anesthesia, for some people, is a scary thing. There are some cat people that are afraid of ketamine. Ketamine is a drug we use for induction sometimes. And the ketamine fear, just in case you've heard of this, I think comes from a time when our anesthetic protocols were very different. But in general, there's really no evidence that ketamine is dangerous for cats or any specific cats. If we've done pre-screening, they're a healthy cat, ketamine should not be an issue for them. So just so you know. And then let's talk about medical issues that can cause increased anesthesia risk. These are big ones. So heart disease. This is something, again, a lot of people have a misconception about. If my dog has a heart murmur, they can't go under anesthesia. Well, that's not true. First, what we want to do if your dog or your cat have a heart murmur, we want to figure out why. And so I do usually recommend that we've done some type of cardiac workup to figure out why they have a murmur. That can include chest x-rays and ideally an echo, an ultrasound of their heart, so that if they have some type of heart disease that we want to treat with medications, we get that on board before we put them under anesthesia so that their cardiac output is as good as possible when we go under anesthesia. I anesthetize dogs with heart murmurs all the time. I do 2-hour dentals on dogs with heart murmurs very regularly. A murmur does not exclude your dog from going under anesthesia. It means we want to pay attention to that. We want to know why they have it. We want to make sure they're treated appropriately for it. But now we have such a plethora of options for anesthetic agents that we can do that in a very heart-safe way. So again, if a vet ever tells you that your dog cannot go under anesthesia just because they have a heart murmur, you may want to get a second opinion because that might not be accurate. And we could be keeping our patients from having comfortable mouths, right? Because dentals are a big part of this conversation. And we absolutely need anesthesia to do a proper oral exam and treatment, a dental. Obesity. This is another thing, concurrent disease we want to be aware of when we anesthetize patients, because in obese patients, the actual drugs can become trapped. So lipid-soluble drugs can actually get sort of bound up in that fat. And so we can have prolonged recovery. And so sometimes when we have very obese patients, we'll calculate their drug doses based on their lean body weight, not their actual current weight. Patients who have kidney disease, liver disease, again, these are all things we would catch and pre-screening, but we do adjust some things based on that. We avoid certain drugs that are that those organs actually process. And then especially with kidney disease, often we're going to give them fluids before we start anesthesia. So those are sort of like the big things I hear people ask about. If we have patients that are really sick that need some type of surgery or procedure under anesthesia, maybe they're dehydrated or anemic because of something that's happened, often we do want to stabilize those patients before we put them under anesthesia. Sometimes that's not possible. So sometimes we have dogs that have emergency needs for surgery and anesthesia. And so we put them under anesthesia right away because we have to. And then whoever's running their anesthesia needs to be very qualified to address those issues that can happen. Okay, so those are the big things I wanted you to understand about anesthesia. There's a lot of misconceptions about anesthesia in veterinary medicine. There's a lot of nervousness in pet owners, which I understand. But hopefully this helps you know what's going on, know what your vet team can and should do about it. And hopefully, for me at least, it helps me to process things I'm nervous about to just really understand. It's like people who are afraid of flying. A lot of them say they feel better if they chat with a pilot who tells them, here's why you're hearing that sound and here's why that's happening. So hopefully this is going to have the same effect. After your pet goes under anesthesia, when they go home, things to expect at home. It's normal for them to be a little bit groggy that night, even the next morning. It's normal for them to just be a little bit out of it and not themselves for 24 hours or so. We do like for them to eat as soon as possible. So I like for my patients to eat that evening after surgery, but sometimes just like a very small meal. We want to put something in their stomach, but we don't want them to vomit after surgery. This is another reason why I like to give them Serenia before they go under. So it gives us 24 hours of antiemetic. So hopefully they don't vomit after their procedure. And some people will tell me, oh, I don't ever want to put my pet under anesthesia again because they didn't recover well. And if that's ever the case, I highly encourage that you chat with your vet about what medications were used. And then if that needs to happen again, that can maybe be altered. And if you move to a different vet clinic, if they can get that information, that can help them make a new plan and figure out maybe what your pet didn't recover well from. So I feel like I just gave you a lot of information, but I hope it's helpful. Send me your questions. I would love to answer some more direct questions about anesthesia. We could do that next week, just some direct questions because I feel like you might have them. So if there's anything big I didn't cover, please let me know. But make sure you're following Dr. Molly Says podcast on Instagram and TikTok and Facebook. You can also watch this if you're listening on YouTube. Make sure you subscribe to the podcast on anywhere you listen to podcasts. Send me your questions. You can DM them to me also at Dr. Molly Says. And I will see y'all next week for the Dr. Molly Says podcast.